If today is your first day watching me on YouTube, you're welcome to my channel. My name is Ubon Okon. I'm a pharmacist. My duty here is to ensure that you live healthy. I want to consider the 5 lies that you may not have known about type 2 diabetes. The number fifth one is very interesting. But before I go ahead, I need you to subscribe to this YouTube channel. Turn on the notification button so that each time I upload healthy contents like this, YouTube will notify you. Let's go. One, once on insulin, you might be on insulin forever. No, this is not true. There might be a need for exogenous insulin to be introduced. Maybe probably because your pancreas was not producing enough or the body was not sensitive to the one produced by your pancreas. So there was a need to introduce exogenous insulin. But now, once insulin resistance is overcome, you might not need exogenous insulin anymore. Once insulin resistance is overcome, such that the one produced by your pancreas is sensitive, the body is sensitive to it, and that the body can use it, you might not be on insulin forever. Two, there's another one that says that if you lose weight, you have successfully reversed type 2 diabetes. No, losing weight is good. It would help glycemic control. It does not mean that losing weight will entirely solve type 2 diabetes. After all, those with diabetes are even lean. Some are lean because of restricted diet. Some of them don't want to eat carbohydrate food. Some are careful what they eat and so on. This makes them to lose weight. So losing weight alone will not reverse type 2 diabetes. Though I know obesity is an environmental factor that could help, that could increase insulin resistance, but losing weight alone will not solve type 2 diabetes. Three, carbohydrate causes insulin resistance, or too much carbohydrate causes insulin resistance. No. But let me tell you, I'm not encouraging you to eat carelessly or to consume high calorie intake, high carbohydrate intake. No. Your greatest problem if you're diabetic is saturated fat. Carbohydrate can be burnt if after eating you are active, you work out. Can be about 15 minutes of workout after each meal is recommended for proper glycemic control. If you eat carbohydrate and you take a walk, it can be burnt, but saturated fat is a major problem. You can have saturated fat, this fat from butter, cheese, palm oil, coconut oil, etc. So your greatest problem if you're diabetic is not carbohydrate, but saturated fat. Reduced glycated hemoglobin, that is HbA1c, is not a marker that insulin resistance has been overcome. It only shows that an individual has been faithful to his or her anti hypoglycemic drugs. That means the person has been taking his or her drugs faithfully. Then it also shows that an individual has a good glycemic control over maybe the last 3 months. But it's not a marker that insulin resistance has been overcome and that type 2 diabetes has been reversed. No. And the last one, that type 2 diabetes cannot be reversed. This is sometimes what we read many years ago, that type 2 diabetes cannot be reversed. New findings, researches, new discoveries have shown that type 2 diabetes can actually be reversed. If your body is still producing insulin, you can reverse type 2 diabetes. One of the issues regarding type 2 diabetes is insulin resistance. So if you can handle insulin resistance by proper diet, healthy diet, type 2 diabetes can be reversed. Type 2 insulin resistance can be caused by several factors. Like I said, fat is a major problem, inflammation of the cells. So you can eat diet that are rich in maybe chromium, vanadium, turmeric is good, that can help to take to reduce inflammation such that cells can accept glucose. Once cells are inflamed, they may not be receptive, they will not pick up glucose. The major cells that can pick up glucose from the blood that will cause a reduction in blood sugar are just fatty cells, muscle cells, and liver cells. So if these cells are inflamed and they are saturated with fat, the poor fat, the saturated fat, they may not be able to accept glucose. And once these cells cannot pick up glucose from the bloodstream, there will be spike in blood glucose. The body will still be the pancreas will still be producing insulin in an attempt to overcome high hyperglycemia, and this leads to hyperinsulinemia. If you enjoy this content, subscribe to this YouTube channel so that every time I upload content like this, you will get notified by YouTube. Thank you. If this was your time, you can share for others to see. Thank you till we see again.